I have a good example of leukemia case, as you can see from my previous DVD. This young gentleman, in fact, he was a leukemia patient, but it was his own choice. He did not accept doctor's treatment, so he did not go through chemotherapy. Although my advice was he should take 3 bottles of GL powder, but because due to his financial problem, he only took 10 grams per day. And we could see results also, because before he took the product, he has to go to the hospital for blood transfusion monthly. But after taking the product 3 months, doctor noticed that his blood count, especially the white count, the platelet count, and even his hemoglobin count was at normal range. So doctor was surprised that why his this leukemic condition has improved tremendously. And of course, he mentioned that he was taking certain nutrient like mushroom powder, and the doctor said, oh, so since it was so good, he just continued taking. So that encouraged him to proceed with his mycelium powder. Till today is almost 3 years, and his condition improved tremendously, and his blood transfusion wasn't needed monthly, but he will, maybe it's necessary is once a year. So that you can see why this patient has such a good therapeutic effect from just a small dose of mycelium alone. This I will explain that because he did not go through the chemotherapy. So most of his bone marrow, with the supplements of this GL and GGL, especially the polysaccharide D6, it will reactivate the bone marrow function. So you can see that especially bone marrow is a center where you produce most of the blood cells like platelets, hemoglobins, and so on. So with that, it shows that this product can balance the function of bone marrow, and that helps him to become a healthy man today. And this is my happiness, because I can see that although a small dose of mycelium can also help my patient. So we can see that why this patient, he benefits so much from the mycelium, because he did not go through chemotherapy. But for another case like this young lady here, she is another case of cancer. Now in fact she suffers tongue cancer. When I look into her medical report, she had a non-healing ulcer on her tongue, at the bottom of her tongue, and of course, and I look at the CT scan, only a few lymph nodes on her neck was revealed, and none of her organs is affected, which is a good sign. But the advice of the doctor was she needs a surgery, whereby they had to cut the tongue into half and do a plastic surgery, patch up on the tongue, and then after that she would need a chemotherapy and radiotherapy. But because the surgery was so drastic that the mother refused. So when they came to me, I looked at the report, it was very positive because none of her organs is affected. So I know I can use high dose of Gadoderma, especially the RC. So what I did was, I started her with the Mycovita. Mycovita contains about 30 capsules of algae and 30 capsules of GL. And most importantly, I wanted more polysaccharides. So I top up with another bottle of mycelium. So we open up 1 sachet of the Mycovita into the bowl with 1 bottle of mycelium, and we add 30 ml Morinzi and Codipine and make into a paste, and she needs to suck it In the morning session, she will suck one bowl of the mixture. In the evening, she will have another sachet and suck in the evening. But we can see that when she started sucking the mixture, she has some reactions and she had severe headache. And when we went back to her medical history, she had history of epilepsy. So you can see that when she take this range of products, although we are focusing, we want to treat the cancer, but when the patient has other problems, this range of product will go and treat some other problems like her brain, maybe some circulations and so on. So because she could not stand the pain in her head, we reduced the dose to half to make her comfortable. And after some time, she's able to tolerate the dosage, and of course we increase the dose again to the normal dose, which is 2 sachets of the Mycovita, 2 bottles of the Mycelium, and with the Morenzi and Codipine. And with that, 3 months later, we could see good results, that her lymph nodes on her neck started to subside, and eventually, up to date, you look at this pretty young lady, is already over a year. She's on this range of product without any medication from the doctor, and she is healthy. And I'm happy to tell you that she just got married, and she's happily married. So you see, this type of therapeutic effect from our range of products, it doesn't have side effects. And patient, you can see the body environment is healthy, balanced pH, improved circulation, enhanced immune system, increased oxygen level, and stable emotion. And that can eliminate the cancer. And of course, this young lady, now she has gone back to work and still maintain her range of products till today. So you see, our DXN products, we are not overclaim why it can heal cancer. Why it can heal cancer? Actually, this is a nutrients that change our whole body environment. We know cancer is a systemic disease caused by poor blood environment, sticky blood environment, clogged blood microcirculation, poor oxygen, poor immune system, and these are the reasons why we are creating an environment for cancer. If we are able to reverse our body environment, yes, we are able to eliminate cancer. Now, I have many questions from people in the public. Why Gado-Dama can treat cancer? This is a great question. Why Gado-Dama can treat cancer? If we go back to the history of Gado-Dama 5,000 years ago, it has proven that Gado-Dama is a super herb for the emperors in China, and they're looking for this type of mushroom to maintain good health and longevity. That's why this Gado-Dama attract many researchers. Why Gado-Dama is able to give good health and longevity. And of course, different researchers will write different effects on Gado-Dama. But when we come back to healing effects, we have to take note that the species of the Gado-Dama plays an important part whether it has good therapeutic effect or not. And secondly, the age of the Gado-Dama. Age of the Gado-Dama plays an important part, especially the reishi. This is a 3-month-old mushroom. Why 3 months old? There are many reishi in other parts of the world, and somebody claimed that it's not effective. Why? Because if the Gado-Dama is growing wild in the mountain and the age of the plant is not monitored, then by 3 months old, most of the spore, which is the concentration of the nutrients, disappear. So when you don't have the spores, Ganoderma cannot give you the therapeutic effects. Therefore, in DXN, our Ganoderma, number one is the reishi, is a red in color. Number two, we control the age of the plant to ensure the spores is optimum in the mushroom. And how you extract the spore is another reason why the Ganoderma is effective or not in treatment of cancer. Now, in DXN, our treatment of the mushroom is by cold method. We freeze the mushroom, and then they will use this machine to eliminate the fiber and just take the concentration of the spores. And our concentration is 20 kilo of the mushroom and get 1 kilo of the spore, and it is 100% spore. And of course, with the spore, we need to crack the shell of the spore to ensure the therapeutic effect of the mushroom. That's why I have shared with many of my patients earlier why DXN Ganoderma, the scanning effect is so powerful, because of the concentration and the way we will prepare it and effectiveness of the reishi. Okay, now the next mushroom is a young mushroom, which is mycelium. In DXN, we cultured this mushroom and it's 18 days old. Why it has to be harvested at 18 days old? Because the polysaccharide is the highest content at this moment. And polysaccharide plays a very important part in the treatment of cancer, because it enhances the immune system, and also it can increase the oxygen level. The organic germanium in polysaccharide will enhance the oxygen level. The combination of the two, the therapeutic effect is the RG will scan the site of the cancer by opening up the circulation. When the circulation is opened up, and at the same time you have good immune system, and most of the NK cells or immune cells rush to the site of cancer, and of course the immune system, the power of immune system killing the cancer is very, very high. So this is one of the reasons why Ganoderma is very good in healing the cancer, because it's healing the environment, improves circulation, enhance immune system, and it also has the ability to stable our emotion. So this is why Ganoderma is very important in healing cancer. But sometimes patients who know me will see that why certain patients I do not give RG, and that is another important question that most of you need to understand. We know that when we give RG and it is a scanner, and when it detects cancer, all the circulations and immune cell will be directed to the site of cancer. And when that happens, the site of the cancer or the lymph nodes, it can swell up, and if this tumor or the lymph node is near any major organs or near the heart, then this will give some uncomfortable feelings to the patient. The patient will feel that after taking Ganoderma, they feel so unwell because of a lot of symptomatic disturbance. So we do not want to cause all this unnecessary alarm to the patient. So if patients have a lot of metastases in their major organs, I will withhold the RG. I will give other products first by giving Morinzi and Codipine. And these two products is essential because when it balances the pH in the body, and it can also reduce the size of the tumor. So the dosage for patients who have these metastases, they can take 30 ml of Morinzi, 30 ml of Codipine. They can take 3 times, 4 times, even 5 times a day is not a problem. And I will give more mycelium in the form of GL powder. GL powder, they can take 1 bottle, 2 bottles, or even 3 bottles is not a problem. Just give them a shaker with 200 ml water. Mix 1 bottle of the GL powder with 30 ml of Morinzi and 30 ml Cordyceps, and just shake it up and drink the mixture 3 times a day. Now, when patient is going through the medical treatment like chemotherapy or radiotherapy, and of course with the gynotherapy, the tumor can shrink in size. And when the CT scan shows that the tumor has shrunk, then we can start RZ. How do we start it? We can start the patient with first week 1, 2, 4, 6 means first week patient can take 1 daily, then followed by second week 2 daily, and then by third week 4 daily, by fourth week 6 daily, then we go to fifth week 9, and the sixth week 12, and even we can go to 18. If the patient can tolerate that dose of RZ, then it is a good news, meaning most of the tumors have subsided and we can come in with higher, stronger dosage of Mycovita. And this is my experience that most of the patients go through the chemotherapy and even radiotherapy together with the gynotherapy with comfortable effects. They don't feel that their condition has been disturbed, and they take it with confidence. And of course, after the chemotherapy, radiotherapy, and gynotherapy, patient feels well. And this is the time that we need to counsel our patient. Not only they need to maintain this product for a longer period, because we know that after chemotherapy, most of the patients they are suffering from the side effects of the chemotherapy, and take about 1 year, and sometimes depends on the patient's condition, maybe 2 years to rebuild their body environment and their immune system. So our duty is to tell them during this period you have to equip yourself with good immune system, good body environment to prevent relapse.